So you're someone who's been told that your cholesterol is too high, and now you're really worried about your heart health. Maybe you're confused about all of the conflicting information that you're getting from your doctors and online. I'm sure you want to know, is cholesterol really the problem? If you're a root cause kind of person, I could understand why you'd have that question. Where is this cholesterol coming from? If your doctors have told you that this is a genetic issue, I'm here to tell you the likelihood of that being true is really low. I want to empower you to understand what's going on in your body and take control of your own health. Well, in today's video, I am going to show you why cholesterol is not the villain you think, why it's important for so many functions in the body, and how you can learn to manage it naturally. I want you to advocate for your own health so that you don't have to succumb to all of the conflicting information that's out there. That way you can take care of yourself the way that you want to without having to be on unnecessary medications. Welcome back to my channel, the channel where I help you to decode your own blood work so that you can manage dis-ease in your body from a root cause perspective. I'm Dr. Artz. Let's get started. So what is cholesterol anyway? And why is it so important? The labs would have you thinking that you can have 0 LDL cholesterol and that would be normal. Well, I'm here to tell you that if you had no cholesterol, you would not be in good shape, just as much as you wouldn't be in good shape if you had too much LDL cholesterol. So what does LDL cholesterol do, and what's important when it comes to reading your labs? Cholesterol is important for producing hormones, reducing inflammation in your arteries, and repairing the inside of your arteries, which can get damaged due to oxidation and environmental toxins, as well as high blood sugar and other types of inflammatory diseases like autoimmunity. The real problem behind having high cholesterol is actually the inflammatory process. This comes from so many different places. When you have inflammation in your arteries, which is a natural occurrence, it's the reason why we have cholesterol. When you have inflammation in your arteries, LDL cholesterol gets snagged on little micro tears on that arterial wall and helps to spackle over it and allows the artery to heal underneath. Now, if you have unopposed LDL cholesterol and continued damage to your arteries, what will happen is that LDL cholesterol will continue to pile on top of itself, calcify, occlude the artery, and lead to things like heart attacks and stroke. So what opposes LDL cholesterol? Well, that's HDL cholesterol. Nobody talks about HDL cholesterol, but it is so important when we're evaluating whether someone actually needs to reduce their cholesterol or whether we just need to focus on root cause and inflammatory perspectives. What I want you to do now is I want you to look at your own blood work, take your total cholesterol and divide it by your HDL. That's going to give you what we call a cholesterol ratio. Now, a lot of labs will do this on their own. Other labs will make you pay extra for it. The good news is it's an easy enough calculation for you to do on your own. The labs that do calculate this for you will have you thinking that a cholesterol ratio of a 4.0 or 5.0 could be normal. I'm here to tell you that we want your cholesterol ratio below a 3. This leaves room for transient inflammation and increases in LDL cholesterol without putting you at an increased cardiovascular risk. So what is the ratio really looking at? Well, the ratio is looking at how much LDL do you have compared to HDL. If LDL is the quote unquote bad guy, HDL is the good guy that helps to clear it away. Now, LDL, as we've already explained, is certainly not bad. We need it for so many things. We need it for energy production in our cells, we need it for hormone production, and we need it to repair the inside of our arteries. But let's focus on your arteries right now. So if you have LDL plaques that are helping to repair the damage on the arterial wall, you need HDL, kind of like a little sander, to come along and sand down that plaque and bring it back to your liver to be recycled. You can see how having enough HDL to oppose those LDL plaques would be important. That's what we're looking at when we're looking at your cholesterol ratio. When we're prescribing medications like statins for high cholesterol, we should always be considering someone's cholesterol ratio, not just what the lab says your total or your LDL cholesterol is. If you're curious about your cholesterol and you want to know what you can do to manage it naturally, download my free guide to understanding cholesterol and natural ways to lower inflammation. This is going to be packed with actionable tips for you to take control of your own health. Click the link below below or in the description. So how do I naturally balance my cholesterol from a root cause perspective? Well, first and foremost, we'll want to make sure that there aren't underlying inflammatory processes. Now, these can be coming from a variety of places. Do you have high blood sugar? Did you know that sugar and carbohydrates are actually where most of our cholesterol comes from? 80% of our cholesterol is coming from something called triglycerides, which are formed when we have excess sugar in the blood. Triglycerides are like little fatty acid backbones that help to build our cholesterol molecules, but we don't want too many of them. Your triglycerides should actually be less than half of your total cholesterol. If your triglycerides are higher than that, the likelihood of eating too much sugar or carbohydrates is pretty high. So one of the ways that you can naturally manage your cholesterol is definitely through diet. Reduce the amount of carbs that you're eating to under 100 grams of carbs per day. And one of the ways that you can track that is with an app like MyFitnessPal. That will help to put out your macronutrients, and then you can calculate what your net carbs are, which are carbohydrates minus fiber. Reducing your carbohydrate and sugar intake is one of the easiest ways to manage cholesterol. But what if your cholesterol isn't coming from sugar or carbs? What if your cholesterol is coming from a different place, like maybe an autoimmune disease that's creating a lot of inflammation? Your liver will produce more LDL cholesterol the more inflammation you have. Well, Dr. Artz, how do I know if I have inflammation? Well, first and foremost, your blood work. One of the reasons why we're here is to help you decode your own blood work so that you don't have to rely on your doctor, who may or may not really be helping you. You can look at things like hsCRP levels. C-reactive protein is a downstream product of the inflammatory cascade that gets set off in your bloodstream anytime you have an inflammatory trigger. Those are going to be different for each patient, but it does tell us whether or not there's an inflammatory process in your arteries. You can also have inflammation in your arteries if you have chronic stress. Now, chronic stress doesn't always mean high cortisol. In fact, chronic stress often results in low cortisol. One of the ways you can test for that is by looking at your AM cortisol on your labs. Other markers of inflammation, we can look at basic blood panels like your CBC, your complete blood cell count. Are your white blood cells high? Are your neutrophils high? Are your lymphocytes high? All of these are important markers of inflammation. We can also look at LDH levels. Lactate dehydrogenase is a breakdown product of muscle. Muscle not only like skeletal muscle, but in our arteries and in our heart, our kidneys, our brain. So it's an important marker to look at when we're evaluating an inflammatory process. Regardless of where your inflammation is coming from, we have to do something about it if we have any chance of reducing your LDL cholesterol naturally. It's important to get to root cause of inflammation when we're talking about cholesterol, because if we just decide to suppress it with something like a statin drug, we've actually put you at an increased risk of cardiovascular disease, stroke, heart attack, diabetes, because we've now taken away your body's only natural ability to repair the inside of your arteries, and we've done nothing about the underlying cause, which is inflammation. There are supplements that we can take to help reduce inflammation, and all of that is going to be in my guide to managing your cholesterol and natural ways to reduce it. Which reminds me, make sure you click on my next video so you can learn more about this topic. Click the video on your screen right now, and I'll see you there.